Module Overview. Effective bedside care hinges on the ability of the caregiver or bedside assistant to accurately monitor vital signs, observe patient behavior, and report abnormalities in real time. This module is critical for any professional involved in direct patient care, whether in hospitals, nursing homes, rehabilitation centers, or private home care. By mastering the content in this module, you will be equipped to identify deviations from normal patient conditions, use bedside monitoring tools safely and accurately, understand documentation protocols and communication chains, meet local and international standards in patient monitoring and safety reporting, including patient safety, ISO 13485, medical devices, quality management systems, JCI, accreditation requirements for bedside monitoring, National Nursing and Midwifery Council guidelines. This module aligns with international accreditation standards and will empower you with the confidence and competence to function as essential care personnel in multidisciplinary health teams. Understanding bedside monitoring. Bedside monitoring refers to the regular and systematic observation, measurement, and documentation of a patient's physiological parameters. It is a proactive care strategy that enables early detection of clinical deterioration and the prevention of adverse events. Core parameters to monitor: vital signs, temperature pulse, heart rate, respiratory rate, blood pressure, oxygen saturation, fluid intake and output, consciousness and mental status, pain assessment, skin integrity and color, mobility and safety status. Vital signs monitoring. Temperature. Normal range, 36.5 degrees Celsius to 37.5 degrees Celsius, 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. Devices: digital thermometers, oral, tympanic, axillary, rectal. Conditions to report: fever, greater than 38 degrees Celsius, hypothermia, 35 degrees Celsius, pulse, heart rate, normal range, 60 to 100 beats per minute, adult. Sites: radial carotid brachial. Abnormalities: bradycardia, 60 beats per minute, tachycardia, greater than 100 beats per minute, respiratory rate, normal, 12 to 20 breaths per minute. Observe chest rise and fall. Report labored or shallow breathing. Blood pressure: normal, 90 over 60 millimeters of mercury to 120 over 80 millimeters of mercury. Use digital sphygmomanometers. Report: hypertension or hypotension. Oxygen saturation, SpO2. Normal, 95 to 100%. Below 92% requires immediate attention. Fluid balance. Intake and output. Fluid monitoring is essential in managing patients with renal dysfunction, dehydration, cardiac failure, post-surgery, recovery. Type what to record. Intake: water, IV fluids, soup, juice. Output: urine, vomitus, wound drainage. All measurements should be recorded in milliliters, ml. Imbalance can indicate fluid retention, dehydration, kidney failure. Observation of mental status and pain. Observe and document. Level of consciousness: alert, confused, drowsy, unresponsive speech patterns, memory recall, mood changes. Pain scale: 0 to 10. Ask or use facial expression chart: mild, 1 to 3. Moderate, 4 to 6. Severe, 7 to 10. Record: site, type, duration, intensity of pain. Patient's verbal or nonverbal cues. Time of pain medications and response. Bedside reporting and documentation standards. All observations should be clear, timely, objective, legibly written or digitally recorded, non-judgmental and fact-based types of reports. Daily nursing reports, shift to shift, handovers, incident reports, full reports, medication and feeding logs. Use SBAR technique for quick oral reports. Situation background assessment recommendation. Example: situation: Mr. James is experiencing chest pain. Background: history of hypertension. Assessment: BP 160 over 110, pulse 110 beats per minute, pain level 8 out of 10. Recommendation: Immediate review by physician. Legal and ethical implications. Maintain confidentiality. HIPAA/GDPR compliant. Do not falsify data. Always report abnormal values. Be honest about care limitations. Informed consent must be respected when interventions are required. Infection control during monitoring. Use gloves when handling thermometers, sphygmomanometers, or patients with open wounds. Disinfect reusable devices. Avoid cross-contamination. Dispose of sharps correctly. Hand hygiene before and after all procedures. Documentation for accreditation and quality assurance. Proper documentation ensures audit readiness, continuity of care, legal protection communication among interdisciplinary teams. Use approved electronic health records, EHR, or structured paper forms. Include date, time, initials/signature measured data, patient response interventions taken,